This meeting of the Sheffield Board of Selectmen to order on September 20th at 7 p.m. Thank you all for joining us tonight. I really appreciate all of you joining us. And I want to let you know that this is also being recorded by CTSB. So for those who are joining us via television a little bit late, thank you. If you can't hear, just like someone, just let us know and we'll try to do our best. Bob, would you turn that up just a touch if you can? Okay, hopefully this is better. All right, excellent. So what we're going to have as our first meeting agenda item is we have the approval of two sets of minutes, July 2nd and September 7th, 21. Is there a motion?
I'll move to approve the Selectboard meeting minutes from September the 2nd and September the 7th, 2021.
Second.
Okay, great. So we have motion and second. Any discussion? All those in favor?
Aye.
Our next item, and I just want to let you know that we do have a public hearing at 7:15. So our next item is the introduction of public health nurses, and I'd like Martin to handle this for us.
Hello, everyone. So we have our two public health nurses as part of the Southern Berkshire Public Health Collaborative. Amy Hart, raise your hand if you would, thank you, and Jill Sweet. They're here tonight to introduce themselves, and we're here to welcome them to the service that they're providing to our community. So with no further ado, I'll turn it over to either one of you.
Thanks, Martin. Oh, sorry. Okay. Now you can introduce you, Jim.
Yeah, that'll come next.
Deliverable director here, Jim. Jim, why don't you start, and then we'll just introduce.
Jim, I was saving that. But that's
Good evening, Madam Chair, members of the board, those listening here tonight and at home. My name is Jim Willis. I'm actually the Executive Director for the Tri-Town Health District, which is one of the oldest health districts in the state. What I'm here tonight is to introduce our awesome skill set of nurses that we were able to hire through a shared services collaborative. So something we've been working on for the past few years, and COVID really highlighted the challenges in the local public health infrastructure, the lack of resources. Massachusetts is one of the only states in the country where they don't actually pitch in dollars for public health systems, and we have a lot of inequities in Berkshire County. There's a lot of communities that don't have paid staff, paid members, limited line items. So what we've done is the DPH is finally, after many, many years, invested significant resources into local public health. And so several of us got together in South County and created a new Southern Berkshire Public Health Collaborative. And because of that new relationship and collaboration, we were able to secure a 13-year, $4.1 million. And the foundation of that is to really build towards working with each other, to build each other up, to get qualified staff, and actually have money to hire full-time nurses. And hiring Amy and Jill full-time, 40-plus hours a week is something none of us can afford by ourselves. And for those watching from home, Sheffield is one of the longest members of the Household Hazardous Waste Collective, which we've been running for 18 years. It's not an easy program, and it's not cheap, and none of us can afford it by ourselves. So we work together, and we all pitch in a fair share to have a really long-standing program. And this is similar to that. So, we're not going to just build a workforce for one town and then farm it out. We're actually going to lift each other up over time, work with the schools, work with the colleges. And ever since Amy and Jill started 2 short months ago, they've been working around the clock, still combating COVID. And I do have a packet here to explain what the new Southern Berkshire Collaborative is. And Pat Levine is the newly elected chair of the Southern Berkshire Collaborative, which is the first chair of the collaborative. And we're really excited to be here tonight, work with Sheffield and many other smaller Southern Berkshire towns working together to really improve public health in Berkshire County. So thank you for inviting me.
Thank you.
Yeah, sure. Hi, everybody. It's so great to be here tonight and to see you all. Thanks for all the good work that you're doing. My name is Amy Hart. I am a public health nurse. I have a background in public health and epidemiology, also in psychiatric nursing. And so I focus a lot on health across the lifespan and both physical and mental and everything in between, which is a wonderful place to do public health work because we all think of our own issues that we may deal with, sometimes physical, sometimes not so much physical, the people in our lives we care about. We have a lot of issues to work on as a community, and so being able to bring our full skill sets, an example of this would be when we began this work, I was able to gain, for the first time, access to some of the COVID and also just all communicable disease data for the 10 towns that are part of our collaborative. And so I started to analyze that and look at trends, and it's already proved helpful as we look from a policy standpoint of what makes sense at this time, whether it be a mask advisory or whether it be certain measures to put in place in our schools to reduce the transmission of the COVID virus. We look at tick-borne illness, foodborne illness, mosquito-borne illness, things like that. We're working closely with the senior centers and councils on aging. We're doing flu clinics in collaboration with the community health programs. We've just kicked those off for the fall season today. So we're looking ahead to a lot of exciting collaborations and partnerships, and we're always eager to hear what folks think would be priorities for their particular communities. We serve 10 towns, but we know that the towns of the Berkshires have some overlapping priorities and some that are unique. I'm thankful to have lived here 11 years, and I don't pretend to know it all. So we welcome the opportunity to hear from you. I'm going to introduce Jill Sweet, our second public health nurse, who knows a lot about Sheffield, and she'll tell you why.
Yeah. So I've been doing the majority of the contact tracing for positive cases that have come into Sheffield, and today was my first experience with somebody who didn't want to answer any questions, which is fine, they don't have to, but then proceed to call me back and state that this is a scam for me calling him, because that's what CVS had told him. So this is really kind of bothersome, because this person could possibly be out in the community spreading COVID and doesn't care. So that's what happened today, which makes me very sad. But yeah, other than that, it's been pretty good. People have been really open and willing to talk and provide information that's been asked of them, so that's been great. Oh, I was a school nurse for 7 years. The first 4 years, I was at Berkshire School, and then the past 3, I was at Undermountain. So I've been working with the schools, collaborating with them, offering my services, helping with testing, answering questions, night and day, weekends. So, yeah, very busy with that. But it's all the schools in South County, not just Sheffield. Been helping the Great Barrington nurses, even though their services are provided by the Alliance nurses. So, thank you.
Thank you both.
So is there any time for questions?
It is now 7. We do have some time for some questions if there's anyone in the audience or if the select board members around it.
Does any of the select board have any questions?
Not at this time.
I'm all set.
Okay, I'd really like to ask, and then we'll open it up to the public if we may. I'd really like to maybe have you speak for a moment about why the Delta variant is so different and in some ways so much more scary, and what's the best way that those of us who are vaccinated versus those who aren't, as well as protecting children, what's the best things to be doing?
Sure. Go ahead to that. You can. Thanks. It's a fabulous question, because really we are in a different phase of the pandemic, and even for those of us who watch the news, sometimes it's hard to put it all together. So I'll highlight a couple things. One is that we now have enough research to know and really consolidated data to know that, unlike at the beginning, we were all worried about wiping off our groceries and everything we touched. We now know that that's very rare for transmission to occur that way with COVID. The 3 main ways it occurs are through droplet transmission, which is when you're talking to somebody and they cough, and some of that enters your body through that way. Those are large molecules. Some of it is through direct contact. You have the virus, it's on your hands because you just coughed, then you pick up a pen, then you set it down, I pick it up, and then I touch my eye. So it is indirect, but we call that direct contact. It's also fairly rare, but that's why we're still washing our hands and using hand sanitizer regularly. The third way is one that I think is fairly underappreciated, but we do, for about a year, we've known that this is a main way, but it hasn't gotten a lot of press, unfortunately. I think as late as May, it still wasn't formally recognized by the CDC and the WHO, and that is the aerosol transmission route. These are the very fine, small particles, and they're mostly released. Of course, if somebody has an active cough or sneeze, some of that is droplet, and then some of it will dissipate into the air and become aerosolized. But it's most often happening from just breathing and just having normal conversation with folks. And the thing about aerosolized transmission is that 6 feet becomes sort of a non-issue. It can travel 20 feet. It can hang in the air for hours, even until the next day sometimes. If you're and it can build up in the air too. So, you're in a room, you've had your mask off for hours, you leave the room, somebody else walks in without their mask on. It doesn't matter if you're there or not. The virus is in the air and you have no idea about that. Now, the thing about Delta, a couple things about Delta that are especially concerning. One is that when someone does have an active infection, they are carrying a viral load, that's what we call roughly how much virus is in your system, of about 1,000 times greater the viral load of the original COVID virus. We call that the wild type. 1,000 times greater, okay? This is what has allowed Delta to become dominant throughout the US over the past summer, from the late spring until now. It just crowds out all the other variants because there's so much of it and it is so easy to spread that way. Now, those of us who are vaccinated, we are well protected against severe illness and death, which is why we vaccinate for all of our diseases, really. That's the primary goal. But the difference with Delta, in part because it has such a higher viral load and it replicates, it makes copies of itself so quickly that we become infectious long before we have a symptom and whether we have a symptom or not. And even as vaccinated people with minor symptoms or no symptoms, we can have the same viral load as an unvaccinated coughing person for the first 6 or so days of our infectious period, and again, have no idea about it. This is why masking has become something we need to do once again, and it's not something many of us really want to do. There are a lot of reasons why it's a real disappointment to be at this phase of the pandemic. While we still have, I think about a third of the adults in Berkshire County are not vaccinated, none of our children 11 or under are vaccinated, we still need to think about protecting them. Our seniors have a very high vaccination rate. Fortunately, we have low numbers of deaths this summer, even as Delta became on the rise and really having a high transmission level in the community. So we want to think about the more vulnerable people at this point. So that's my summary. I don't know if you have any further questions.
Oh, no, I really appreciate that.
Sure,
I really do.
Yes.
Ted?
The booster? We are...
Yeah, nobody can hear anything on the television unless, so if you could repeat the question that Ted asked.
We just had a question about the booster, and I presume you mean for fully vaccinated people, a third dose or a second dose with the Johnson & Johnson version. Yes, from the federal level, there is a process that's going on. We are now past the first stage of it, where a special FDA panel was convened to discuss whether or not and under what conditions a booster may be advised. There was a recommendation made, I believe, for people over 65. And when we already, of course, had that advisory for folks who are immunocompromised. We are awaiting the next stage, which is an ACIP panel that will convene next week, and then they will advise, and then the CDC will have to take up their recommendation, and they tend to go with their recommendation. And then the final phase will be the Massachusetts Department of Public Health, in conjunction with local public health leaders, deciding how to roll that out to the communities. And we don't There are many conversations going on with that. We're sort of waiting to see the finer details of the priorities, and then the plans will be put in place and finalized. So we will all be letting you know when we know.
We've got time for one more question, if there's one more question from the public. Anyone have a question? Board members?
No question.
Sari?
What about in a situation like this?
Sure.
And we've got coffee windows open, and I'm assuming that is on, but we've got the headphones on. How helpful is that?
Extreme.
So if you
That's a
could
great
repeat the question, so
Yeah.
everyone who might be watching as well as here.
So this is a question about this particular indoor setting, but I'll speak about in general indoor settings. In this particular room, we have windows open on either side, and we have, it looks like a filtration system that's on, that's cleaning the air that we are all breathing. These are excellent. Anytime we can maximize our ventilation, and so, you know, basically maximizing the amount of outside air that exchanges with the inside air, we reduce the amount of virus that can build up in an indoor setting. This may be your work site, in your office, or in a restaurant where you're going to eat. In your own home, if you have someone who is actively infectious, you want to really pay attention to this. As we get toward the cooler months, this is again why with current transmission levels, it's concerning that there's enough virus still present in the community. As we all start to hunker down indoors as things get cooler, we will be exposed to more virus in the air in indoor settings. So we want to think about, again, masks as a really good barrier, and we want to open windows and have things like that going on anytime. And have, you know, you can change the settings on your central heating and air cooling so that you have a higher rate of exchange with outside air. And a lot of schools and businesses have already done this from what we learned, so. All right.
Wonderful, thank you.
Thank you, Amy.
Thank you very much. Martin, is there anything you want to add before we close this section?
Just in light of Jill's comments about the contact tracing and reaching out to patients that are infected, the Board of Health, as well as our role as Selectboard and even my role as a private citizen, we really appreciate the people that work with us and support the work that our public health nurses are doing. And we're asking for cooperation, whether you believe in the vaccination or not. You've got professionals who are relying on science, who are putting their heart and soul into this work for the care of the community. Please participate, please cooperate. Try not to make their lives any harder than they are already. That's all. Thank you.
Okay, thank you. Thank you, everyone. Next thing we're going to do is go ahead and open our public hearing regarding suggestions on the American Rescue Plan Act funding. Sheffield will receive, by the time this is over, about $935,000. We can encumber that money through 2024 and spend it if it's been earmarked through 26. I'm just going to tell you what we're going to do tonight is, first of all, we've received a number of suggestions through email, which I very much appreciate. We will continue to take suggestions. So if you are, after this hearing, if you would like to send a suggestion, even on the topics that we're going to cover tonight, that's wonderful. And you can send it to jhughes@sheffieldma.gov, or you can just, drop a line in the mail. The next thing we're going to do is next meeting on October 4th at 7:15, and I'll announce those topics tonight. We're going to pick up the rest of what this money can be used for. And so we're starting to take suggestions on that. After we have all of the suggestions, we're going to kind of look them over, try to put some prices on it, see whether there is a common thread, see what there might be public support for, and then we're going to try and, we'll spend some time on it, but we'll make sure that all of the items that seem like they kind of are deserving or rise to the top for funding, actually are approved by the federal government so that we don't go ahead and spend money and then find that it wasn't approved, because that's kind of a process. It's not a simple process. It's not a clear process. So before we take public comments tonight on two particular items, items that are in response to COVID-19 public health emergency or its economic consequences, which are very, very, very key. And there was a nice article in the Sheffield Times, and then Rhonda also sent out an email blast, and it was on the news. I'd like to just read into the record highlights of the suggestions that we have received. And if you're here and you've already sent your suggestion, or your suggestion mirrors what has been read, you don't need to necessarily make a comment unless you're the person who didn't write it in. And if you wish, you can say, I support this or that. But I would prefer not to have people who have written to us then get up and talk about their item ahead again, because we've got it. So one resident has suggested assistance to households for food, rent, mortgage, utilities, etc., assistance to small business and nonprofits, improving internet access, funding job programs, improvements to community outdoor spaces, capital investments in public facilities, purchase of personal protective equipment as needed, mitigation and containment of COVID, wish we could do that one, and assistance to business startups. The next one we have is a library patio provide outdoor meeting event space, the third floor above us. Develop that out so that we can spread out the staff here at Town Hall. Turnout gear for the fire department, and also relief on back taxes. Residents who are behind in their taxes, specifically making agreements with them regarding regular payments. Another one that we received is to, again, support job programs and small businesses. Also to extend internet access to those pockets of the town that were missed in the last Spectrum contract, or really it's the last time Warner build out. Also funding of concerted efforts to control invasive species in our woodlands. Likewise, a community issue with perhaps the possibility of partnership with the Land Trust. The next one we have regards the Sheffield Association, specifically, this is a 501c3, supporting them in the cost they have incurred from providing the Sheffield Times to all residents and households in Sheffield and Ashley Falls over since May, June of 20 through March, April of 22. And I know everybody's following along with me, so if I miss one, please let me know. There's also another suggestion of the Welcome to Sheffield sign that we have talked about before at this board in the center of the village green. There's also a suggestion for the acquisition of a backup generator for the library, and this would make possible the use of the library as a safe warming shelter, as well as a cooling station, which I believe it's now being used as, or has been in the past when it's been abnormally cool or abnormally warm, along with the senior center. I think that's been the case. Also, there's a suggestion to set aside additional funds for acquisition of lots or dwellings reasonably close to the village green, and the development of environmentally sound, affordable housing in conjunction with subsidies from state and federal government. There is also a request to assist a resident who has been evicted, And due to health concerns and just what's been going on, we'll need to hire professional movers to pack and move this person's belongings. There also is the suggestion, instead of having our porta potty out here off of the town parking lot, to have a self-composting women's and men's toilet, as well as support of a potential future statue that might be coming to town that we're not at liberty to talk about right now, as well as grave markers in the center cemetery, recognizing those buried in the cemetery in unmarked graves, which there's apparently in excess of 100 people. Did I miss any of them? I got
I
them?
think you've covered everything.
Okay, so let's do this. If someone would like to make a statement as to how they feel this money should be spent, would be more than happy to take notes on that. I would just ask that you, as always, when you go to the mic, introduce yourself and where you live. You can just give your street, and then keep your comments as brief as you can. So is there anyone who would like to suggest any additional uses? You'll have additional time to send an email, and then we'll again be taking comments on some of the next two possible uses. George?
George O'Lane, Foley Road. The American Legion, which is at the north end of town, has also been used in the past for cooling and warming town meetings, etc. And this past year, we haven't been able to do diddly squat like anybody else. But we would like to upgrade the windows and lighting and heating system or heating and cooling, so it'd be more usable for, townspeople that want to run it, and also try to make the restrooms more handicapped accessible. The building was built back in the 50s. The windows are that old. We have tried to make a lot of improvements, but money's been short. And if we wanted to put air conditioning in, we're looking at 10 grand minimum.
And of course, the American Legion is a nonprofit.
Pardon?
The American Legion is a nonprofit.
Correct.
Okay.
We're 50C19. And any assistance we could get from that would be greatly appreciated.
Thank you, George.
Catherine Miller, 801 Clayton Road. I'd like to expand upon the suggestion that the internet be improved and suggest that we ought to look into fiber optic. We've got too many people in this town, particularly businesses and young children, who are trying to do their homework in the back of cars because they don't have any access to internet in their homes. We've got people who are trying to do business from their homes, one of whom you're looking at, and the internet is just horrible. And I think as a town, we need to do more to improve not what we have, make it more upgraded, so that we really can have action in this town, bring people in, bring in economic development as a result of being able to communicate with the rest of the world.
Thank you, Catherine. Are there any other comments at this time?
Kathy Orlando, 116 Main Street. And I would like to expand, agree with the piece about the internet. I know a lot of kids who were having a really hard time getting homework even before the pandemic happened. And so when you're doing remote school, it really gets exacerbated. So definitely agree with that. Also want to expand, there was an item that was read about being able to address housing with lots and an additional building. And I would like to expand that to saying that there are a number of larger homes in the center of town that could we could partner with other organizations that work on these things to be able to purchase those and be able to do multifamily homes there, whether it's ownership, whether it's rental, that kind of downtown infill, where it's something where people can walk to be able to get certain things that they need, is really, really crucial. So that, and there's some items for the next meeting that I'll wait till the next meeting to talk about.
Okay. All right. Kathy, were you talking a little bit about what you and I know as the Brattleboro Fund, where money is set aside to help homeowners pay for the remodeling, or most of us don't have $60,000 sitting around. So the town, and it's called Brattleboro because it started in Brattleboro, Vermont, and it's been extremely successful in the housing business of helping people make in-house apartments that then can be leased out. Is that what you're talking about?
That's part of it, definitely, and that the bylaw, the accessory bylaw that the town passed was designed to be able to help do that, and being able to have some funds available for people to do, to get architecture come in, because there are a lot of, people used to call these in-law apartments. There's a lot of things that are out there that are not necessarily up to code, and so to be able to have like a kind of a safe haven period where, if you've got one of these, great, let's just make sure it gets up to code so that you don't have any issues with fire, as well as having the funds there to be able to help with doing both their architecture and the improvements. But there's also some places that, there's not as many now because of the pandemic. A lot of people have been buying them, but there are still some of the larger homes in town that could be purchased entirely and made into multifamily homes, not necessarily by the owner who's there. And you can, partner with a community land trust in the Southern Berkshires, Construct, Habitat. There's a lot of ways to be able to do this, to take advantage of the partnerships that are available out there.
Okay.
Absolutely.
Great. Thank you, Kathy. Okay, so unless there's anyone else who wants to speak at this moment, I'll take a motion to close this public hearing.
So moved.
Second.
I have a motion and a second. Any further discussion? All those in favor? Aye. Okay, so let's do this. I want to encourage people to send in their ideas. I think we have a very rich collection of ideas, but this topic on public health and the economic impact of the public health COVID emergency, that topic is not off the table. You can continue to send in comments on that. The next two, because there's only so many things that the government, the feds, are allowing this money to be spent on. The next two that we're going to take up on October 4th, 7:15, is premium pay for essential workers. And what they say in their byline on this is funds may be used for additional support for those who have faced the greatest health risks because of their service in critical infrastructure sectors. I think that can be interpreted a lot of different ways, okay? So that's one we'll talk about on the 4th. And the other one is water, sewer, and broadband infrastructure. And what they say on that is, may invest to improve access to clean drinking water, support wastewater and storm water infrastructure, and expand access to broadband internet. From what we have understood so far, you have to own the sewer and the water companies, of which we have neither. Stormwater, I think there's probably a lot of things that we could do in that area. And then we come back to the topic of broadband, which I'm sure there'll be a number of suggestions on the 4th. So are we okay are we clear on what comes up next? Okay. All right. Wonderful. Thank you. So let's go on to our next item, which is discussion and possible action regarding Barnard Cemetery. Jim, I see you're here. You're on the Cemetery Commission. I see Tammy's here. I see all of you are here. Okay, all right. So Rhonda, would you just walk us through this, and then we have all the Cemetery Commission if we need to ask questions. Thank you.
So we have a letter from the Cemetery Commission regarding Barnard Cemetery, which states that at the annual town meeting in 1978, there was a vote to accept a piece of land that would be dedicated as a municipal cemetery. So the Cemetery Commission would like for the Board of Selectmen or the Select Board to determine the town's desire for the direction of this additional cemetery. Do you wish to acknowledge the designation of the rectangle? Is this addition to Barnard Cemetery, will it be open to all burials? Excuse me. If yes, should this area be laid out for cremation burials only? Or shall a pauper section be reserved in this area? So the commission is looking for direction on this. I don't know if any of them want to expand further than what's in the letter to help you decide.
Let's start with Martin.
I would ask the cemetery commission members to give us their opinions about some of these questions. What are your thoughts in terms of, for example, the designation of the Fletcher rectangle, and should it be open to all burials? And should an area of it be laid out for cremation burials only? And should there be a paupers section reserved? I'm interested, this is more subject matter that you deal with. What would your thoughts be?
Yes, did you reach a consensus on a yes or no on each of these 4 items that you've asked us to make, to give you some guidance on? Have you reached a consensus? So on the first one that Martin asked, do you wish to acknowledge the designated Fletcher proper rectangle? Do you have a thought as to whether this is a yes or no, or you have informed thoughts at this moment? You're waiting for us to come up with something?
Renee, I think on number 1, this was donated to the town, and so I think that would be the first easiest one for the board to make the decision that you're going to at least accept that piece of property, and then decide later what you want that piece of property to be used for.
The thing that concerns me on reading this, I remember once on the Board of Health, we had a burial issue. And if I remember, the lawyers, the situation on that is that the town, and probably Tammy knows this, and Jim, and also Malin, that you have to have land donated for a cemetery to be accepted by the town voters. I just don't think, and it says in this letter that it was not stated in the original town article. So I'm concerned that this wasn't properly accepted.
I think it was accepted by town voters. That's clear. What is unclear is whether it is reserved for the Fletcher heirs.
Well, it also says that it contains a rectangle in the second paragraph, which was not stated in the original town article that the town accepted. That says to me that the town voters did not accept this.
No, they accepted it. Am I wrong on this? The town voters did accept it. What that wasn't stated was whether that section is reserved for the people who donated it.
Okay, so I'm going to try the second paragraph one more time. It says, the deed recorded contains a rectangle which was not stated in the original town article the town accepted. Is that correct?
You're missing the reserve piece, Renee.
No, I'm
sorry if I'm confusing.
I understand what she's saying. I think the parcel was larger than the reserve.
Yes.
And the reserve was not stated in the article, but was included in the deed. So therefore, she's saying that the article was not presented properly. That was voted on.
So what I'm saying is this is way beyond ours. We need to have some legal counsel as to what it is, first of all, that we need to do. Was this properly accepted by the town? And I may be totally wrong, but I just remember so vividly on this burial that if you were going to have a burial area, the town has to accept it. So I would hope that Mark would tell me I'm totally wrong, but I would just like to have this letter reviewed by town council and make sure that with the deed, maybe the deed needs to be updated, maybe the town meeting article was correct and the deed needs to be updated, or maybe the town article is wrong, I don't know. And I don't have the skill set to read through this and see. But I think what Martin is asking is that if the Cemetery Commission does not have a thought on what you would like or what you would recommend these 4 answers be, that maybe it would be good if you thought about it and came back to us, because you are all much more involved in this than we are. Is that correct, Martin?
Yeah, I would have that.
Jim?
James Miller, 801 Clayton Road. I don't believe that the commission actually has a common thought about what should be used with the property, with the space, if it is properly accepted.
Okay.
One of us, I can't speak for others, but they're here and they can correct me. There's some thought that it should be a paupers area. I'm of the opinion that being a historic cemetery, that it should be very carefully used, if used at all. It's a major tourist attraction. It's an outdoor museum, really, of historic Sheffield art made by local artisans from local materials. And I believe that that theme should be maintained in that cemetery.
So I think we probably need a lot more information than, I mean, this is a very well-written letter, but I think there's more behind this letter that we may need.
Well, since we were invited, we have not had a meeting. I have to say that right up front. So
All right. Oh, okay, okay. I also am curious if, and I know that, I don't know if both of the Fletchers are still with us, but I know Barbara is.
I'm sorry?
I don't know if both of the Fletchers who signed this are still with us, but I know Barbara is, but...
None of the others is alive.
Okay. It seems to me like if they gave this with a designation that it be reserved, that also has to come into play somehow.
And I'm not clear on that, whether it's given to the town to be used or given to the families to be used. I don't know that. I don't know what the answer to that is.
Okay. So,
There's a related critical third paragraph that the Fletcher and Proppers gravestones are not within the designated area shown in the sketch on the deed. So even though they reserved a 15 by 20 foot rectangle, that's not where they're...
We believe that's the case, yes.
and we didn't get the sketch. So we didn't get the sketch.
Didn't what?
We didn't get the sketch on the deed.
Oh, okay.
Okay, so, so board members, how would you like to proceed on this?
My preference would be that the Cemetery Commission meet again and at least provide us with your collective thoughts on the questions 2 through 4, which is, again, is this addition to Barnard Cemetery open for all burials? If yes, should this area be laid out only for cremation burials? Or shall a pauper section be reserved for the area? And whether the commission wants to reach out to the general public and get opinions from them as well. But I think it would be helpful in our next meeting, if we could, to have you come back and at least provide us with some guidance. We, as a select board, I think, need to work with our town council to answer the question about the reserved rectangle. I don't know how else we can do that.
I also wonder that if you do make a determination about how it should be used, my question then would be, are you setting a policy for the other cemeteries in town that the town does maintain? of which there are at least 9, if not 10. So I think that that should be considered too.
Well, we can, Rhonda, you were shaking your head. I may have my own opinion, but you have a thought, I think.
Well, I'm thinking that this question needs to be answered just for this particular cemetery at this time. The others, I believe, are all closed for burial. So the only open issue that we have to talk about is this piece of land that the town accepted but is never used.
Well, in all of the other cemeteries in town, there are a lot of open spaces that the town has accepted. And so I don't know how you could deal with this specific one without dealing with all the other ones.
Well, we can very specifically say, this is this. We can very specifically say, these questions are being answered for this particular portion of a cemetery. We can fence it, so to speak. We can fence our decision. So, and if we need to, we can even say this is not applicable and just, to any other cemeteries. Now, if you have other cemeteries that you're looking for some guidance on, then that would probably be good to bring again with your thoughts. And I don't necessarily assume that your thoughts would be unanimous. So I think if they are not unanimous, I think we're looking for what are the thoughts of people on the commission, even if they are not unanimous. If there's 2 or 3 different opinions, that's fine. We'll take 2 or 3 different opinions.
I have a question also. Do we have the opinion of the Fletchers or Probers about this?
I'm sorry?
Do we have an opinion of the Probers and Fletchers about their view of this piece of property that was given?
If you're talking about the people who donated, no.
Right. I would kind of like to have their opinion.
The Propers are both deceased, and at least one of the Fletchers is deceased.
But was this supposed to be reserved for additional Fletchers and generations?
That is the question.
And I would like to know what their opinion was going forward when they donated the property.
Or what the motion was actually at the town meeting. I think
Yes.
it's more significant than.
That's more.
Right.
And that's not included in this packet. We can get that. Yes, it is. It's in the article, excuse me. Yeah, so we have the article and some of the deed, but not the sketch. All right, so we have some work to do, but I think where we are on this is we have some legal questions to get answered, and then we'd very much like the thoughts from the cemetery commission on these matters. Okay, are we good? Anything else, Martin?
No,
Bob?
thank you.
Nope, all set.
Rhonda, anything else?
No.
We're good? Okay, great. So our next item is an action regarding application for the fire department. Martin, would you please handle this?
I'd be happy to. So the select board and town administrator were presented with yet another application to the Sheffield Volunteer Hose Company for an applicant to join the fire department and the hose company. Her name is Haley Liebenow. She is a dietary aide at Fairview Hospital. I've seen her attending some of the practice sessions. She has been approved by the Vigilant Committee, and she has completed and delivered us a complete file that is ready for our action.
Have we heard anything back on the quarry?
No.
All right, so we need a motion.
Yep.
I make a motion to accept the application.
I'll second that,
Subject to quarry results?
subject to court results.
Okay, is there any further discussion?
No.
I wanted to just say, I think our fire department needs to be recognized for their incredible ability to attract younger people. And I think Haley is, what did you say, Martin? Is she about the 5th or 6th?
I've lost track. It's at least 6, but probably closer to 8.
Yeah, and this is incredible. So many of the fire departments are having trouble recruiting the next generation, and our fire department has done extremely well. So, Rhonda, did you want to add anything?
No.
No. So we have a motion and a second. Let's do all those in favor?
Aye.
Aye. Okay, great. Thank you, Haley.
Yes, thank you.
So, discussion possible action regarding Collins Center proposal for a capital improvement plan. Rhonda, would you like to take this?
Sure. So we were fortunate enough to receive funds from the Community Compact that allows us to create a capital improvement plan. We received $16,000 to do that work. The Collins Center reached out to us to say that they have worked with many municipalities doing exactly this. So we had a conference call today, Renee and I did, and spoke with Sarah from the Collins Center, and she laid out the whole steps on how that would work. She thought the amount of money that we had was workable, clearly with Sheffield and creating that. It would also include an inventory of each of the departments, what they have. They would work directly with department heads to get their needs, and they would also put an estimate for the cost of all of those projects together. Sarah's going to submit a full written proposal, step by step, laying out exactly how this program would work. She will have that to us by tomorrow afternoon for the board to take a look at and decide whether we would like to work with the Collins Center. Because they are a state agency, the Collins Center, we do not have to go out to bid for the company to do this type of work. She's also provided several references from, I think there's 3 or maybe 4 towns where they've done exactly this project.
So, go ahead, Mark.
Just a question. I know the select board and the town administrator were contemplating having an intern or interns do some of the back-breaking work of putting the inventory together.
Mm-hmm.
Would this be done in conjunction with those internships?
You certainly could,
Okay.
because our discussion with Sarah today included some of the work that the town could do itself and provide them to keep the costs at the amount of money that we receive for the grant.
Okay.
Typically, I think they charge around $20,000. We have 16, so if we had that extra work done and could present to them, it certainly would keep the costs within that range.
Thank you.
The deliverable at the end, which you'll see in the report, it's an Excel spreadsheet, so it can be kept up to date. There's nothing that's static. And also, the various forms would likely be in Word. So this would be, they would start off with a 5-year plan, and then we would roll it.
The other part that I thought was really good that Sarah explained today is they help you identify a capital expenditure versus something that should be in your budget. And they have a way of scoring all of those projects to help you understand that. Plus the budget component piece that comes along with it is, can you afford this project? You know, everybody has these projects or purchases that they would like to make, but is it realistic, and can Sheffield afford to do those projects?
This scoring system that Rhonda was speaking about, I found to be very interesting because it's a third-party look at the projects, not the usual kind of who can make the best case. It's really, what does this look like, just kind of flat, and that would be done before it would come to the town in the final report. So there's kind of a third-party eye on this. So that's kind of the plan. I think we were both extremely excited.
I was.
At one point, we had thought that maybe we would use our accounting firm, but we used the Collins Center really to start the whole review of our treasure collector office before we went to Department of Revenue and had the service provided for free. So they did a good job. They got us started. So we'll see that, okay? Anything else we good to move on?
Is there any motion that you would like to see with regard to the continuing work? Good.
No, I mean, we'll just, you both will have to read through it. and as well as the two of us, and see what you think makes sense. But this has been a project that's been on the burner for, I'm surprised there's any water left in the pan, to be honest, but it's been on the burner for a long time, so we'll see what happens with that. Okay, the next item is discussion possible action regarding the food diversion program. You want to take this? You want me to do it?
No, you can do it, Renee. You're the one that's been really involved from the beginning.
As you know, the town authorized at town meeting some money to expand programs, but we also got under the Community Compact second grant money to do a food diversion program for a year. And so because this is going to be under a certain amount, we were able to just go solicit interest in bids via a letter. I reached out to 4 companies that I've been working with for over a year, and only one was able to kind of get to the point where of what we had discussed, which is a pickup of the food that's been diverted from households to the transfer station every day that the transfer station is open. So we don't have food accumulating in a container that's dumped once a week with the smells and the need for the Board of Health and the need to avoid the bears. So I think in another 3 years, I think there's going to be a lot of people in this game of picking things up on a very regular basis. But the only person who responded and could meet the requirements of that was Melissa Higgins of Berkshire Compost. She's the owner-operator. You can see from her cover letter and also her bid that she will pick it up every day that the transfer station is open, and then they collect the food waste, goes to the Stanton home, which is a local farm in Housatonic, where it is processed into finished compost, which I understand is sold for use in local gardeners. So it really supports potentially 2 small businesses. So I think the question is whether the board wants to accept this bid and award to her for a 1-year program. I think we'd probably be ready to start this program with the advertising we need and the rest of it. I'm thinking October 15th or November 1st.
Right. I was going to say a month, so that fits right in. So somewhere within the vicinity of the next month.
Okay, we have to find a place for it at the transfer station, okay? But one of these days, we are going to track down our engineer who has the larger question of our transfer station. So sometime maybe between October 15th and November 1st, okay? And we'll be getting some, I don't want to call it advertising, but some promotional materials out about this. One of the things that I liked very much about her is you scrape it off the plate. You don't have to pick out the meat, you don't have to pick out the fat, you don't have to pick out the cheese. If it's on the plate and you are going to eat it, you scrape it into your bucket. And then any bucket, probably with a cap, you're good to go. This will be a real bonus, I think, for transfer station users. And that will, for those of us who participate, will take all of this out of the trash stream and make it really a reusable, resellable product. Again, we've talked about this, but they estimate that up to 28%, I don't know what Sheffield is, of garbage that goes to the garbage landfills is food. And now we can save that, and when you go to the transfer station, just take your bucket. Any bucket with a lid will do. There's nothing special about the bucket. So what would the board like to do?
I have some questions.
Sure.
So the proposal shows a rate, since it would be 4 times a week, $8,320 a year.
Mm-hmm.
That would be paid by selective additional transfer station fees?
No, we got the money for it from the grant.
The money pays for this first year
Yes.
fully? Okay.
Yes, and that should give us time to evaluate.
That's good.
And to see whether we're really, swapping one cost for another cost. Just a second, George. So we have the money on this. We're not paying for buckets. People have to provide their own buckets, okay? But that's what we wrote in the grant.
Okay, so, and we will send out information that people have to bring their own 5-gallon plastic pails.
2-gallon, I don't care what they bring it in.
container.
You know, you just can't put the bags in the 96-gallon totes that she will put in her truck. She will provide the totes.
Okay.
Okay. Anything else,
No,
Martin?
that's.
How many times a week were we proposing?
I'm sorry?
How many times a week were we proposing? 3?
4. So when we were talking about this, and again, you know, since I've gotten into this recycling coordinator, it's really, I've talked to a lot of people. You want to make it as easy as possible so that you don't have to think, oh, I can only take my food on Fridays, but I go to the transfer station on Tuesdays. Now, I would expect there's going to be an up curve on this, and if it's, I don't know, you know, we have the money for a year, but if it's going nowhere, or at the end of the year, there's nobody using it, it's gone.
Right.
So this is really, somebody's paying for, the state is paying for a pilot for us. Okay. George? Yes, please.
The only problem I see with this is that if you throw meat scraps in there, you're going to attract rodents and, you know, bears and what have you that, you know, we really don't want at the dump, you know, I mean.
They're going to have to be very quick because the dump is opened from 1 to 4, 2:30, or give me the.
8 to 4 on Saturday.
Yep, 8 to, and
Sunday is 8:30 to 2.
So they're going to have to be really quick because this food is going out every day. It's not staying overnight.
Right. That's part of the agreement.
And George, from what I've understood, with the right tote that is kept closed, okay, and the tote is cleaned every time it is picked up, or a new tote is given, you don't have the residual value. I mean, George, we're going to have to evaluate this. Nobody else is doing it. Okay, this is a really kind of an interesting thing, but we're going to have to make sure, and I know the folks out at the transfer station are going to tell us if there's any problems going on. Okay, but thank you for your concerns. This means we'll have to keep an eye on it. Anyone else? So what would the board like to do?
Just one further question. Has Melissa Higgins provided you with any form of agreement, or how do we signify if we were to authorize you to execute an agreement with?
We'll ask her for an agreement. Many of the places that we're dealing with, like the apparel impact, they'll take an agreement or they won't. It's what we want. Okay.
Or we'll go off of one of our metal and just retrofit it to.
Yeah, we'll have an agreement.
The food program, we will have something.
Yeah.
That's all I have.
Okay, so what would the board like to do?
I'd like to make a motion that we authorize Rhonda Lombard to enter into an agreement with Berkshire Compost for a 1-year trial period of food diversion.
I'll second it.
Okay, we have a motion and a second. We'll also put in this contract, you know, the cost, it's price fixed. We'll also put in the number of times. We'll also put in that she provides the containers at the transfer station, that they're cleaned. I mean, we'll nail down the details. Okay. All right, so we have a motion and a second. Anything else? All those in favor?
Aye.
I have to tell you, I'm very excited about this. I'm going to abandon my home compost pile and bring my things to the transfer station, all right? Because I do get the bear, and we'll just avoid that. All right, next item is discussion possible action regarding Bootstrap information on curbside food waste.
I don't have the information.
Oh, okay.
From this. This is the email that was sent to you from Andy.
Yes, I know, yeah.
Yes.
So the other thing, two of the people that I spoke with and responded back, or one of them who responded back. They don't do this for transfer stations, but they are willing to provide curbside pickup for homeowners. So when we get this package of information together, with the board's approval, we're not recommending anyone, but you need to let us know if you think this would be good to just provide a simple note. If you want curbside pickup, please contact this person on your own. The town is not endorsing this company, or something of that sort. Does that sound reasonable?
Yes.
Do we need a motion on that, Rhonda?
No.
No, okay, great. So compost is becoming big business. It's amazing, it's terrific. Next item we have is discussion action regarding a one-day alcohol permit for Dewey Memorial Hall. Rhonda, would you walk us through this, please?
Sure. So they've applied for a one-day alcohol permit for the following dates: September 24th, October 3rd, October 14th, October 16th, 17th, and October 22nd.
And we have all the proper insurances, et cetera.
We do.
Is there a motion on this?
I make a motion that we approve the application for a one-day liquor license for September 24th, October 14th, October 3rd, October 16th, October 17th, and October 22nd.
Second.
Great. Any further discussion? All those in favor?
Aye.
All right. Next is the announcement of the radar speed sign locations. I think what I'd like to do on this is, first of all, thank everyone who provided us input on the 6 radar speed sign locations. I think what's probably the simplest that we'll do is sometime in the next week, maybe week and a half, we're going to have a simple map that will appear on the town's website under news. It's really hard to say by poll 37, okay? And we'll go out and make sure that the stakes are in the right places, and I'll get a can of red spray paint, or we'll do something to try to even make them more outstanding. We had a lot of comments, and it's just really interesting. People really helped on this, and there also are areas where we're also going to be looking that maybe didn't get one of these to improve either a speed sign or a children in the area, or be alert to bikers and walkers, because there's a lot of things going on Ranapo and Silver Street and Cooper Hill, and we just don't have enough signs to put them every 300 feet. So, and then hopefully we'll get those installed, we will get them installed by the end of the year. So, any comments on that?
Do we want to acknowledge any of the criticisms that have come about posting yet more signs and more signs?
There haven't been any.
I think there is. There's a packet. There's a letter from Dave Smith Jr.
Oh, all right. Then why don't you acknowledge it?
Yeah, well, so we had a letter from a concerned citizen expressing concern over yet more signs that are going to be ignored, which I have seen, I do have personal experience with seeing these speed signs that warns you of your speed and if you're going too fast. A lot of people actually drive so that they can violate the speed limit and see how fast they can go. And it's the congregation of flashing speed signs around Silver Street, Cooper Hill, and Ranapo Road. The question is that indicating that that's the only areas within town where speeding takes place? Because I can categorically answer where I live that most people try to go 70 to 80 miles an hour in a 40-mile speed zone. I don't think signs are going to help there. So anyway, we do have concerns expressed from the citizen.
And we do have David here. First of all, we cannot put any speed signs on 41 because it's Mass DOT. And we went through how much trying to get the speed signs on Route 7 before we got the flashing pedestrian through an absolute lucky Mass DOT grant. where they allowed us to do that. I think we spent years after Jillian was killed in the crosswalk. So no, the other thing that goes with this, David, is that the police chief has committed to do, Rhonda?
You don't have the correct David in the audience.
Correct. This is Dave Senior.
Yes, this is Dave Senior. I'm used, you know, it's interesting because I apologize to everyone. When I saw this, I thought it was from Dave Smith Jr., who had, which it is, but he didn't put Junior on it. And he had talked about where he wanted some signs placed, but also he had talked about this. So when I saw it, I was thinking Dave Smith Sr., who is with us this evening. But what I wanted to add is that the chief has said that he will step up enforcement to go along with this. Otherwise, you know, we're just wasting the state's money. So this is what he has said. And I'm one of those people who does slow down, okay? So, you know,
I go 40 miles an hour on Route 41, much to the chagrin of all the Connecticut and New York people behind me.
well, that's their problem, not yours. Thank you for going 40. So, yes, he's right. I mean, I think also the reason those 3 streets were chosen is when this grant was written to get this stuff, we went to the police department and asked us, what are the 3 roads that you get the most complaints about? And the chief and his officers came up with those 3 roads. Personally, I thought nobody would want these signs. But as it's turned out, people who are in Ranapo and Silver and Cooper Hill have seemed to be very open to them and have made suggestions as to where they go. So, I don't know. Does anybody want to say anything about this? Okay, we'll honor Dave Sr. first. Okay, Lauren?
Lauren Hyde, 535 Collicock Road. I was just wondering if you guys remembered, I think it was in April or May, Sam Stolzar reached out to the Board of Selectmen about some radar or something on our street, and there was going to be, I forget what the action item was that was going to take place.
Yes, and it has taken place. BRPC has done a traffic thing, and we're expecting that report from them.
Cool. I was just wondering, because this was like on the agenda.
This is a whole different topic.
Got it.
No, BRPC did go out, we asked them to do a traffic count.
Great.
Via one of those clickers on the road, and they did that. So we're expecting that report.
Okay, cool. And did they do speed too? I
can't answer any other things other than they do a normal traffic measurement, and I can't tell you what's included in that. It's one of those things that you see stretched across the road, and when you go over it, you feel a little bump.
Oh, I have no idea. But, okay, I was just curious.
So I would expect that we should see something on that in the next, several weeks.
Okay. Thank you.
Thank you. Dave Senior?
Dave Smith, Senior, Silver Street. I'd like to start by saying that, Martin, you're not the only one that drives the speed limit. And I've got a lot of New York and Connecticut drivers on Silver Street very upset. Because when they race up behind me, I slow down.
Yes.
Then they go 20, 25, and they blow their horn. And if they try to cross the double line, I move into the middle.
Be careful, Dave.
Anyway, one concern I have is the location of where these signs are going to be. Every car that goes by in the middle of the night, that thing's going to go psh, psh, psh. And there are houses. We're in a rural district, and there are houses. And the one on the beginning of Silver Street is right across the street from a house. My house is too far away. I won't be able to see them. It doesn't matter. But I think we need to think about the one that's on on my property or on the side of my property faces another house up further, right before the bend in Silver Street. And I just think that needs to be considered.
Thank you, Dave, we will.
Okay.
Yes.
And lastly, enforcement. That's a joke here. Our town enforces nothing regarding speed. I'm going to tell you, I can pull out of my driveway, and it's 1,200 feet from my driveway to the turn in Silver Street, okay? And I can't get 200 feet down the road before I've got people running into my bumper. And there's never a cop on Silver Street. I very seldom ever see anybody unless there's an emergency. Then they'll send 2 or 3 cars. That's great.
Thank you, David. Wait, I'm not quite remembering because there was one that was going to be put a ways up between Bull Hill and a ways up from your, yeah, I think.
There's
yeah.
2 on the down end of Silver Street.
Yeah.
One past the railroad.
And one by the railroad.
A little ways past my
Yes,
driveway.
yes, okay. All right. Anyone else? Sari?
Sari Hoy, 60 Main Street. I just want to sort of reiterate what Dave just said, because that was my question, is if Chief says that we're going to give out more citations, how does that actually happen without them being there? Because Michael, I don't know those signs. Do they actually track how many people?
From what I understand, it is a warning. Okay, some people obey it, some don't. But it's meant to slow the traffic down and show you what you are actually driving at what speed.
Yeah.
The police are going to have to get out there.
Yep.
And in talking over this with Chief Munson, I'm myself recommending tickets rather than warnings. But that's his department, and they may give warnings first. But there will be an emphasis on enforcement. Otherwise, I agree with everybody. The signs are useless. Even though they're solar, they're useless.
I like them. Because if I'm speeding, I don't mean to be. So they're a good reminder. And I really like the one in Stockbridge that actually says thank you when you are going the speed limit. It's always nice to get a thanks now and again.
Anyone else? Otherwise, we're going to move on. Okay. Thank you. Our next item is a letter from the library. They're requesting, well, Martin, why don't you just...
I'm happy to.
Yes. Mm-hmm.
So the library trustees are working with our new library director, Dina Caswell, on a very interesting initiative that's being presented by the Smithsonian, the big Smithsonian in Washington, D.C., and they have had a traveling exhibition on, it's called Crossroads, Changes in Rural America. And it is kind of swept the western and central United States, and it's making its way to the East Coast. It is a wonderful exhibition of life in rural America and how that has changed. And given, Sheffield's unique position as an agricultural center, as a rural area, mainly rural town, and with a very activist library director, Dina Caswell, we would like to apply, the trustees have decided to apply to host that exhibition for 6 weeks. We don't know exactly when it would be if it was awarded, but the library trustees are seeking letters of support for the application process. The Selectboard has in front of them a draft of the letter of commitment template, and therefore I would ask as a member of the Selectboard if we could review that and potentially take action on it. The application is due September 24th, and
it's Friday.
The trustees and Dina have been working very hard on this.
Bob, do you have any comments?
No, not at this time.
Yeah, so are you looking for approval tonight, or are you looking for approval on our working session on Thursday?
Well, I'd like to have approval tonight so that we can get this letter finalized. If there are any changes,
Okay.
we'll make the changes, but
I think I have a couple of changes, suggestions. I think one thing that should be emphasized is the proximity to New York, Albany, Boston, and Connecticut areas.
Yep.
Berkshire is very centrally located. I also think that we should stress in this letter that Sheffield is the oldest town, 1733. This is where the Berkshires began. And, you know, just the absolute rich heritage in this. You know, you say Dewey Hall, but you don't say how it started and what it was. You know, I know this can't go on forever. But a little something that it was, why it was founded. It was basically the library and the public meeting, Shays Rebellion, you know, the number of people, the Sheffield articles that supposedly became the template for the Declaration of Independence. I would also, in the fourth paragraph, cross out the total and grant awards. I don't know if that's a big deal in libraries, but that's not a huge deal. I would just leave it at 4 grants or 3 grants and cross out the dollar amount. I don't think that adds. And I would get rid of on the second to last paragraph, I just put a comma rather than the parenthesis. Other than that, I think it's great.
thank you.
I would make a motion to approve it.
I'll second it.
And I'll just leave those comments up to you, Martin. Okay? So do we have any further discussion?
Oh, I'm good.
Okay, so this means we really need to get this signed this week?
Yes.
Okay, all
So you're
right.
going to make the edits and send it over?
I'll make the
and
edits.
Get it in letterhead?
Yeah, that would be great.
Okay.
I'll do that tomorrow morning.
Great, all right, so we all need to get in to get this signed. So we have a motion and a second. Any further discussion? All those in favor?
Aye.
Okay, that's taken care of. Wonderful. Thank you. Let's go to board items. Martin?
Yes, the only thing I have is from the Sheffield Board of Health. At our last meeting, the members of the Board of Health voted unanimously to repost our recommendations and really a strong directive about wearing face coverings inside, particularly given the Delta variant, and with regard to wearing masks outside if people can't effectively social distance. So I'd like to read the public health directive that was approved. It was written by our chair, Pat Levine. It says, the Sheffield Board of Health voted on September 13th, 2021 to issue a directive that all residents, visitors, employers, and employees wear a mask while indoors in public settings, regardless of vaccination status. Further, masks should be worn in crowded outdoor settings when social distancing cannot be maintained. These precautions have been proven to reduce the risk of illness from airborne diseases, including COVID-19, and to mitigate the spread of such disease. That's the directive.
Okay, so what are we going to do with this? Is it going in an email blast? Is it going on the front door? Is this getting posted somewhere?
Yeah. The Board of Health didn't make a decision on how it would be posted, but clearly it is a simple directive that can be posted on our public buildings, and I don't think it needs to go to an email blast situation, but I think, again, a posting of latest news from the town of
Put it
Sheffield.
in the news section. Okay, and we have masks available at the front door.
Correct.
I know we have them up here. We'll make sure that those are stocked, and we also have hand sanitizer.
Correct.
Okay, great.
That's all I have.
Anything else, Martin? How about you, Bob?
I'm good.
Okay. I just wanted to bring up one thing. When we were talking last week about expanding the bulky waste bin to household homeowner construction debris, boards, a little bit of sheetrock, some of that. What we didn't talk about, and I apologize, Rhonda and I had talked about it, I believe, and I had talked a little bit with Frank. The idea of taking high-quality boards, high-quality construction materials, given their costs, and possibly having a section in the swap shop where those could be placed if someone wanted to get those, okay? That was discussed with Bob and Frank on whatever day it was, Saturday, Friday, and it was felt that that would be acceptable if the board wanted to do that. Did we not talk about that, Frank? Are we good? Second thoughts?
Frank Clark, Silver Street, Sheffield. The only problem I've been thinking about that is how we secure that
the materials?
Lumber, the material that comes in here, how we can secure it to prevent it from falling over if somebody accidentally bumps into it. I'm not sure that this is a good way to do it, but...
So maybe, I think you've got a very strong, good point. Maybe what we need to do is to postpone this thought for a couple more, months until we know where the swap shop is going to go. It may be that we extend a roof and put some of those pegs, so that the boards can be held.
Yeah.
So, thank you, Frank. I think we should, I'm going to withdraw this discussion point.
Yeah, I think we got to give it a little more thought then, and maybe take the rack out and, like you say, build some bins and something.
Maybe they don't belong inside. Okay.
Can we hold on that?
Outside where they can be better secured. Okay.
Thank you.
Thank you. This is why good conversation is always good communication.
I'd just like to say, too, that in the past month, we've had a few people come in and really be appreciative of what's going on there. So it's, I thank the public for coming in. We've had some good remarks on it, so.
Is this anything in particular, just how wonderful the transfer station looks?
This is on general everything, so.
Okay, all right.
Well, part of that's a testament to you and Bob as well, so thank you.
Yes, absolutely. So we're just going to announce tonight that probably, did we say next Sunday, this Sunday?
Sure.
That starting this Sunday, if you have homeowner construction debris, we're not looking to have your contractor leave everything at home and then you put it in a truck and then you bring it. But a lot of us have, some, a little bit of tile board, some sheetrock, some masonry stuff, tile that's left over, some lumber. If you would like to bring that, and jump in here, board, if I get going too much. If you would like to bring that to the bulky waste container and dump it, we'll take it. You need to bring a coupon the same way you would if you were to put anything into that bin. Unfortunately, we're not going to ask our attendants to get into what's a carload or what's a truckload. I only have one board. The same things that apply for the bulky waste will apply for the construction debris. And we'll monitor it, and if we see too much stuff, whatever, no asbestos, nothing that needs to be disposed of in another way. We're asking our attendants to kind of keep an eye on this and see how it goes. We may have to adjust it, but I think this is going to be a really nice addition to our bulky waste bin, and we will start that this Sunday, and we'll get some materials on it as fast as we can out to the public. Are we good with that, Frank? Okay, we're good?
The only thing I wanted to emphasize at the very beginning of your discussion, little bits, not semi-trucks full of the housing.
Well, it's a carload or a truckload. That's what's bulky waste. If we see things that look like somebody's bringing in that they're a contractor, this is a home residential program. It's not a business program. We'll have to take some action. So this isn't the new place to dump your stuff if you're a contractor and you happen to have a transfer station sticker, okay?
Thank you.
But I think this is going to be really nice. My sister was out to see the transfer station. We made a special trip, and I'm going to have to tell you, she was so impressed, and she lives in a very, she's been there for so long, but it's gotten rich around her, Palo Alto, California, where people are really quite absurd, but she could not believe how neat and clean the transfer station was, how everything was so orderly. The signage, Bob and Frank were both there, just the way people were conversing. She was very, very impressed, so kudos, okay, to everyone involved, all right? So, Rhonda, how about you?
I don't have anything right now.
Public comment? George?
Yes, George Olin again. I noticed in the Sheffield Times, you were talking about the different recycling efforts that you were putting on at the transfer station. And in there, it mentioned the book box that's on Legion property for the Friends of the Sheffield Senior Center. And you mentioned something about, there was mention of something about another box going in there.
Apparel Impact Clothing Recycling.
Pardon?
Apparel Impact, the green clothing recycling.
Okay, that's on Legion property. We were supposed to be getting 10% of whatever the Friends of the Senior Center got for the box being there. Okay, the Friends of the Senior Center, the last I knew, are not getting squat.
So you can take that up with the senior center?
We have. But what I'm saying is, we don't want any more boxes there. We're going to try like the devil to get rid of that one that's there because it's not generating any income for either of us. If they want to continue recycling books, take it over to the transfer station.
All right. So one, what I was trying to say is the senior center is now receiving money for the books, but I will let you take that up with the senior center in terms of a revenue share. Eileen can talk with you, but I'm going to talk with Rhonda as to what that situation is, and we will do that offline, okay? We heard your comment.
Yeah, because we don't,
Okay.
you know.
Yes, we heard your
We
comment.
had an opportunity some years ago to have one there, and the guys decided we don't want a bunch of chicken coops around there. And that's what their boxes look like, their little buildings look like.
So again, take it up with the senior center, and then Rhonda and I will discuss the issue of the apparel impact, okay? So who else has a public comment, if any? Okay, Sarah?
Sorry. Oh, no, you know where I live. I guess it's just a sort of response to what George just said, and I realise that you know the property is owned by whomever it's owned by, but if the only time we ever do anything kind or giving, which the book the collection is about literacy in our country and beyond. If the only reason that we ever do it is because we make money, that's pretty sad that's the only incentive. And I'd like to think that we could be a little bit more giving than that, that's all.
I'm not going to get into a discussion of that, okay? All right, is there any other public comments for the board, items that are under the board's control? All right, if not, I would take a motion.
So moved.
To adjourn. We have a motion and a second. All those in favor?
Aye.
Thank you, everyone, for coming this evening. The next time we see you, we expect everyone to be wearing a face covering. And also, thank you for joining us on CTSB.